You know that weird burning pain in your foot? The one that just hangs around? Well, you're definitely not alone. We're about to dive into a real medical mystery here, something that tons of people have, but doctors often completely miss. So let's get into it.
So it usually starts with this odd feeling, a burn, a tingle, maybe a sharp ache deep in the sole of your foot. And it gets way worse when you walk or even just stand for a bit. A lot of people say it feels like they're walking on pebbles or something. It's super frustrating, totally confusing, and it can really mess with your day-to-day life.
Okay, so what is this thing? This mystery pain? The problem is, it gets misdiagnosed all the time. People are left just wondering without any real answers or treatment that actually works. So, what's behind this nagging pain that seems to come out of nowhere?
All right, here it is. The condition is called Tarsal tunnel syndrome, or TTS for short. The easiest way to think about it, it's basically carpal tunnel but for your foot. What's happening is that a really important nerve is getting pinched in this narrow little space in your ankle, and that's what's causing all those weird, painful feelings in the bottom of your foot.
And here is why this is such a fascinating mystery. TTS is like a master of disguise. Seriously, its symptoms look a lot like other common foot problems, like plantar fasciitis or even a pinched nerve coming from your back. And because of that, it gets missed constantly. That's why figuring this out, cracking the case, is just so important.
Okay, so to solve this thing, we've got to go right to the scene of the crime, which is the tarsal tunnel itself. Let's zoom in on the anatomy of the ankle, so we can see exactly where and why this poor nerve is getting into so much trouble.
Okay, let's meet our main character, the tibial nerve. Just look at this thing. It's this whole complex network of wiring. Think of this nerve like a super important data cable. It runs all the way down your leg and plugs into the bottom of your foot, giving you feeling and muscle control. So what happens when that cable gets squeezed? The signals get all scrambled, and boom, that's where the pain and numbness come from.
Now, the real issue here is the space this nerve has to travel through. The tarsal tunnel is, well, an incredibly crowded neighborhood. The floor is just solid bone, your ankle and heel, and then crammed inside you've got tendons, an artery, a vein, and of course, our tibial nerve. The roof is this really tight, tough band. It's kind of like a one-lane traffic tunnel under a city at rush hour. There's just no extra room, and that makes the nerve super vulnerable to getting pinched.
So what's actually causing the big squeeze? Let's round up the usual suspects, shall we?
Okay, so the causes pretty much fall into two camps. You've got intrinsic causes. That means problems inside the tunnel itself. Things like varicose veins or little cysts that are just taking up valuable real estate. Then you have extrinsic causes. These are pressures coming from the outside. Think an ankle sprain, having flat feet, or even bigger health issues like diabetes.
But, and this is the really wild part, the biggest twist in this whole story, in a huge number of cases, we're talking up to 96% in some studies, the cause is idiopathic. That's just a fancy medical term for we have no idea. Right, no cyst, no injury they can point to, no clear reason at all for the nerve being squeezed. And that is what makes diagnosing this thing so incredibly tough. So, this leads us right into the diagnostic puzzle. If doctors often don't even know what's causing it, how in the world do they figure it out? Well, it turns out the clues they have to work with can be, let's just say, a little unreliable. Okay, first thing you've got to understand, there's no single magic test for TTS. There's no gold standard here. A doctor can't just order one thing and get a clear yes or no answer. The diagnosis really comes down to listening carefully to the patient's story and doing a thorough physical exam. Let's talk about the tools in their toolbox. A really common one is called Tarsal sign. That's where the doctor just taps over the nerve. If you get that zinging feeling, that's a positive sign, but it's not super reliable. You can get that zing even if you don't have TTS. Then you have the more high-tech stuff, like nerve studies, an EMG. These actually measure how well the nerve is working. But here's the kicker. They can be wrong in both directions. And get this, they can come back totally normal in up to half of all real TTS cases. Crazy, right?
And this quote from Dr. Ibad Shah really hits the nail on the head. He says the diagnosis relies on the whole clinical picture, supported by all these different things. It really drives home the point that it's not about one single clue. The doctor has to be a detective, piecing together the patient's story, what they see on imaging, the nerve studies, maybe even some test injections, all to build a solid case for TTS.
So, okay, let's say the detective work pays off, and you finally get a diagnosis. What's next? What's the resolution? Let's look at the path to actually getting some relief. The treatment plan usually follows a pretty logical path, starting with the simple stuff first. Step 1 is what they call conservative care. You know, rest, physical therapy, maybe some orthotics for your shoes, and medications to help with the nerve pain. If that's not cutting it, the next step might be an injection. They use a local anesthetic, which is cool because it can both help confirm the diagnosis and give you some temporary relief. And then, if all of that fails, the final step is surgery.
But how well does the surgery actually work?
Yeah, this is where things get a little complicated. When you look at the studies, the success rates are all over the place. I mean, from as low as 44% to as high as 96%. That huge range tells you one thing: success is definitely not a guarantee. It really depends on a lot of different factors.
Just to give you some perspective, let's bring back its more famous cousin, carpal tunnel syndrome. Surgery for carpal tunnel, it's usually way more predictable and patients tend to be happier with the results. Tarsal tunnel surgery, though, it's much more of a wild card. And that's because the foot's anatomy is so complex and the reasons for the compression can be so different from person to person.
So, what can improve your odds of a good outcome? Well, research points to a few things. Being younger helps. Having a really clear, obvious cause, like a cyst they can just go in and remove, is a big plus. A positive Tinel's sign before the surgery is also a good sign. But here's the most important takeaway for sure. The less time you've had the symptoms, the better your chances are. Getting an early diagnosis is absolutely key.
And what does this surgery actually involve? Well, you can see it right here. It's called a release or a decompression. Basically, the surgeon goes in and very carefully cuts that tight band, the flexor retinaculum, the roof of the tunnel we talked about. That one little cut opens up the whole space, and just like that, the pressure on the nerve is gone.
So we come full circle, back to our central mystery. Tarsal tunnel syndrome really is that classic hidden culprit. It's a condition that's surprisingly common, it can be totally debilitating, and yet it's so often missed. Which leaves us with one final, really important question to think about. Could an overlooked, pinched nerve be the real villain behind your nagging foot pain? It's definitely a mystery worth solving.